We're going to introduce this topic. It's an emerging topic. There are about three topics floating around the industry right now that are really hot, and those are carbon, resilience, and health and wellness. And I think it's good for all of us in the industry to become a little more informed and a little bit more able to carry on conversations within these subject matter areas. So I'll let you can read the slide. I won't read it to you. We're going to try to describe a framework for beginning to understand health and wellness in a building, how to apply that framework to our current design, construction, and operation processes, recognize some of our issues and challenges that are unique to the built environment, identify our common design and operational pitfalls maybe, and then recognize some new and existing building rating systems and look to the future. So here's our agenda. It's fairly short. I want to take a look first at some toxins in buildings, and then the things that are really close to building service engineers' hearts: ventilation and air quality, lighting, and comfort and productivity. And then let's look forward. So some of this presentation comes out of the work up at Harvard T.H. Chan School of Public Health. You'll see it referred to probably a few times throughout the presentation, but looking at this pie chart and a quote from the school there is, "The people who are responsible for design, operation, and maintenance of your building may be as important to your overall health as your primary care physician." And you can see that, access to health care is 10%. Your built environment can affect your health care as much as 20%. And then, of course, we all know, those of us that like to eat and things like that, that our behaviors have a big impact on our health and wellness. Another slide you may have seen or seen in different forms in the past, or just in operating the built environment, that only about 10% of the cost over the life cycle of the building go to energy maintenance and mortgage and rent. So building owners, company owners, homeowners all should be interested in their built environment and how healthy it is, because 90% of the salaries and benefits or the 90% of the life cycle costs of a building are built into the salaries and benefits that are associated with the people inside buildings. And this comes out of that Harvard T.H. Chan study, but it's published by a group called forhealth.org. It's the 9 foundations of a healthy building. And if you'll just spend a minute and look around there, I don't think there's one of the 9 that the building service engineers and mechanical engineers in the U.S. Are associated with, and many times responsible for at least the design and construction of. And then our service engineers that are facility operators, they're responsible for maintaining those systems and keeping those systems functioning properly and the environments they control healthy. So let's look at the first part of the agenda today: toxins in our buildings, and why are toxins important? So why do materials matter? I mean, materials are the building. They're the things that are all around us, and most of us seem to think that when a new material or a new combination of materials and chemicals are put in front of us to consume, whether it's consumed by placing it in a building or actually, really consuming it as food or beverages, that those chemicals and those materials are safe for humans, and that the U.S. government, or any government, your government has said that's true, but most times it's not. And this next slide will tell some of the story. Out of the 80,000 or so chemicals used in manufacturing, only about 85% of those chemicals in use today have 85% of them have no health data available on them. And then 67% of them have no data at all. So if you move over to the list, there's only about 300 chemicals that have been tested for safety, and less than about 20 chemicals that have enforceable regulations associated with them, at least here in the United States. So that leaves a lot of guesswork. I don't want to paint a doom and gloom picture. You know, since the Industrial Revolution as a species, we've certainly prospered from and proliferated, going from about 2 million people for millions of years to now almost 7 billion people on the planet. So I mean, we're not all we're not destroying our species at all, and we just need to know. And out of 80,000, you can say that we've got 80,000 opportunities to learn a little bit more about what the effects of these chemicals and their combinations can have on us. There are 6 classes of chemicals, though, that have been identified for us to avoid, and those are, number 1, the highly fluorinated chemicals, antimicrobials, flame retardants, the bisphenols and phthalates, and some solvents and certain metals. And, you know, the plastics, the bisphenols, you see those in baby bottles, toys, water bottles, bromated and chlorinated paint strippers, cadmium coatings, and short and long-term exposures can have many different effects. So many of our common building materials have toxins. An assessment of looking at about 102 commonly used building materials found 86% of those contain chemicals that are toxic to mammals. And some of those that are, and if you'll take a look at percentage of US children with detectable toxin levels, well, you take a look at mercury, lead, PCBs. I'll take a look at those 3. Those 3 were regulated back when I was a kid, and I'm 63 years old. And if you just take a look there at the percentage, you know, when they test children today, 89% of them still have mercury in their systems, 100% have lead, and 100% have PCBs. And those chemicals have been regulated since the 60s and 70s. So they can have long-term and lingering effects in our environment. Much of those, the mercury and lead and PCBs we see are floating around in the air or in the soil, and we all as children play in those environments. And then every day, if you look, there's a study published somewhere about the effects of the link between toxins and some negative health effects and outcomes. To people. Tim said this would be posted if you're interested in learning more about that, at least the ones I've put up here on the screen, there will be links within the in the presentation for you to be able to go to some of this primary work and do some reading on your own about what we're finding in the area. And then sometimes a lot of toxins don't even work. The Chicago Tribune did a very good Pulitzer Prize winning series in the Chicago Tribune on flame retardants, and they've been found to be no evidence that the flame retardants in home furniture and baby products are effective. That in many cases just the coverings themselves can be designed such to provide equivalent levels of flame retardants without the negative health effects. I know in our area, that's been a hard sell to some of our building code officials, like our State Department of Education, who still requires flame retardant furniture in our schools and elementary schools and kindergartens. But there is no requirement, again, in the U.S. now. You can buy furniture and you can always look at the labels as a simple way to make a difference, and take a look at the label to find out and know that what you're buying doesn't contain something like flame retardant chemicals. There are lots of resources that are coming online, such as this one, Home Free, that is an easy to use public resource to take a look at the materials you buy and use around your home, flooring, paint, and drywall, and understand the chemicals that are being used in them, and what the potential effects might be that might help influence your specification or your consumer and purchasing decisions on a day-to-day basis. And lastly, one real easy thing to do, and these are simple. I'm trying to pass out some simple things that, just like with disease control, one of the easiest things we can do to avoid chemical exposures is to wash our hands throughout the day. Many of the chemicals are contained in dust and those frangible fibers that break down as we walk on flooring materials, rub against furniture and fabrics and the walls and things like that in a building, and generate dust. And all you've got to do is, and then as you put your hands on those surfaces and bring them to your mouth and eyes and nose, they get ingested or introduced into our bodies. And a very easy way to avoid it is just to simply wash your hands several times a day. So now let's move on to our indoor air quality and health, and some of the effects it may have on us, and why it's important to keep good indoor air quality in our buildings. So there's been several studies. If you look down this list at the number of studies, I think all of us would agree, though, that it's quite obvious that we need to do more. But the U.S. Army Corps of Engineers has done several studies, and they did 3 studies on adding more ventilation for Army recruits, students, and office workers. And you can see there that 33 to 40% less respiratory illness and 15% less absence cited in one study were in buildings that were provided with more than the prescribed minimum. So I'm going to say more than the ASHRAE 62 minimum requirements. When you add more space to a building, occupants, one study was done at Antarctic science stations, and then another study was done on office workers, but somewhere between 17 and 50% less respiratory illnesses and cold illnesses. And then when you combine the two studies in nursing homes, it really jumped up 49 to 76% less flu and respiratory illness. We see a lot about electronic air cleaners and UV radiation these days. And again, we need a lot more science on the effectiveness of this, but the U.S. Navy recruits, one study showed 23% less respiratory illness in buildings where the coils had been irradiated with UV. Air-conditioned buildings versus non. Again, Army Corps of Engineers study, 16 to 27% less cold symptoms. And then finally, one of the big ones, especially in homes and multifamily, residences is mold versus no mold, and in buildings with no mold, 54% less respiratory illness. So what about CO2 and what's the right amount? I mean, it continues to climb, as you can see with this graphic here. And after the presentation, if you download the slides and click on that YouTube there, you can get an animated version of this. So carbon's an issue, and controlling it and reducing it in our atmosphere will be one of our biggest challenges in the next few decades. So CO2's levels in the home. One of my partners is very interested in this topic, and he actually worked at Harvard and participated as a subject in some of these studies. So he kind of outfitted his home with some sensors and things like that, and looked at the variation in his living room and bedroom at CO2 levels throughout the day, and then overlaid that onto the this is the area where it says there's impaired performance with increased levels of CO2. And actually, I believe LEED and now the Well Building Institute has recommended set points in schools as low as no higher than 800 parts per million in those environments. So CO2 can vary a lot through the day. So learning from some sensors, a few more sensors we've installed, and this is kind of a little funny story, but we're tracking temperature, humidity, CO2, and VOCs, and a couple of other things, PM 2.5. So one day he gets a text or an alarm from his sensor on his smartphone, and he texts his wife what happened, and she had just plugged in one of those new essential oil vaporizers, and not all VOCs are equal, and some are not as bad for you possibly than others, but we really don't know if you go back and look at that slide about the 80,000 chemicals that we don't know anything about. So we do know benzenes and formaldehydes are bad and carcinogenic, but what about some of these other chemicals that we use every day and take for granted? The impact of particulate matter. So having good filtration and good ventilation rates so that we can pick up those dusts and harmful particles in our buildings. The PM 2.5 and the PM 10 data, some of the things have been attributed to that. And again, I have an EPA New England study cited that you can go to in the slides later, but been associated with cardiac arrhythmias, heart attacks, respiratory effects, increased hospital admissions and emergency room visits, absences from schools if you go back to the table, and absent days from work, and restricted activities. So let's go to some of the easy things that we can do. NASA, with the International Space Station, and has done a lot of research on what kind of plants can improve an indoor environment. If you look at this study at these plants, you'll see that most of the plants are good at filtering out benzene and formaldehyde, two of our most worrisome chemicals. Lots of people like to have lots of plants around. This is, again, the young man I talked about that we put the sensors in his home. This is his desk. The other side looks just the same. He lives in a jungle. And then other easy things to do is use your windows. Most residents don't have ventilation systems, so windows and doors are the only way they get fresh air. Commercial buildings, again, are more likely to have ventilation, but if the windows work and outdoor air quality is better than indoors, certainly use the windows when you can. And a lot of monitors now are available at very low cost that can alert you when fresh air is needed, and they range anywhere from $100 to $300. All right, so some research impacts and solutions. Let's move on to lighting. Again, trying to move a little fast. I know we don't have a lot of time and get through a lot of material with just an introductory level here. Circadian responsiveness. So our light throughout the day, we're very, over millions of years of learning and exposure to light. We have circadian rhythms that affect our sleep cycles, our alertness, our concentration, can change our mood, how well we cognitively process information, and our productivity. And when our lighting does not match the natural cycles of our local environment that we're used to, it can have negative effects on us. So a lot of lighting systems today are trying to mimic that. We have ways of matching circadian lighting levels in buildings, on our computer screens, and those things by putting them into dark mode. So lighting influences. It suppresses melatonin and in many cases increases serotonin, so it disrupts light, especially the blue light waves. It delays timing of our circadian rhythms. It elevates alertness, and all of that makes it harder for us to fall asleep and stay asleep. And those studies, CB Richard Ellis, CBRE, is a large commercial office developer and building manager throughout the United States, and they found a 12% improvement on the productivity test for people in spaces that had circadian controlled lighting. And then lighting and sleep, I mean, they can affect us about as much as being under the influence of alcohol. So this lower axis is the time of day. This is the mean relative performance over here, worse as you go up. You can see here blood alcohol levels, 0.05 being a minimum level that says you're intoxicated, and upwards close to 0.8 and above are legally impaired. And then this table here on the right shows you the time of days when single vehicle fatal truck crashes occur, and you will see that they occur early in the mornings and nighttime. That's when the peaks, and many times those owners are found to have been deprived of sleep, been up 24 hours or more at a time. Like I mentioned, we on our computers and our smartphones now, we can enable the dark mode where we get rid of the blue light and go into a much warmer light, and that can be set to happen automatically based on your location. What our smart devices can do for us now. You can remove blue LEDs from your bedrooms and alarm clocks, or put tapes over them to keep you from seeing those lights all night. And there's all kinds of lamps available at your local hardware store now that will eliminate that blue light, especially in children's bedrooms and things like that. Now, comfort and productivity. Again, we'll look at a study real quick. And this is a study that was done over 351 buildings, 53,000 occupants. And if you know, most of our thermal comfort standards prescribe buildings must provide satisfactory thermal comfort for 80% of their occupants. But if you look at this, and if you turn what you see here in these numbers between -1 and 1 as being neutral, general buildings generally perform worse than our our thermal comfort standards. And if you'll look, here is the different areas that were analyzed. And if we were to take these numbers and convert them if into satisfaction rates as compared to, say, the 80% standard for ASHRAE 62 for thermal comfort, this would result in only about 2% of the people being satisfied most of the time, or very satisfied, if you took +1 to +3 as being very satisfied. And then if you increase that range to 0 to +3, if you just use this here, you would only have about 8% of the people being satisfied in the building. And then if we stretch that out and say, well, let's go from -1 to 3, we get to about 33% of people that are satisfied in buildings most of the time. So we're falling short, and that just sends a signal that we've got plenty of opportunities for more research, better design practices, better guidelines, and ways to provide better overall comfort, not just thermal comfort in buildings. Temperatures, productivity, it's also been shown. This is a study back from 2006 that increasing office temperatures from 72 to 87 reduced performance in the workplace by 10%. I've seen a couple of standards come out, or a couple of recommendations from organizations recommending indoor office temperatures up in the 80s, and I wouldn't want to work in a building all day long that's above 80. In fact, it's been my experience in the buildings we commission and work in throughout the East Coast of the United States that most people tend to like their temperatures around the 73, 74 degrees in the 50 to 60% RH range. Noise. There's a big survey in hospitals, and the complaints for noise in hospitals are 2 to 1 compared to other complaints. And when you're already in a hospital and in a compromised situation, we do not need our indoor environment working against us. And it's been shown that it disturbs patients' sleep, decreases oxygen saturation in blood, elevates blood pressure in newborns. You can see the table, slows wound healing, and then fosters negative perceptions of patient comfort. And when a patient's uncomfortable, they're not resting well, they're not healing properly. So very important in hospitals, especially, to maintain noise control. So can buildings make people physically more active? Been studies promoted, and there's some guidelines out in promoting physical activity. Most of that associated with how we move around the building, our wayfinding, and it not always pointing us to elevators, but encouraging us to use stairwells and designing stairwells where they're more accessible than the elevators are. So improving their appearance, adding motivational signage, add music, speakers, background noises to get rid of unwanted noise. Some of the things, providing free fruits and vegetables instead of just the vending machine in the building, and hold contests among people within the building and challenges to let people compete for doing healthy things within the building. So let's look forward, getting close to the end here, so we can have some questions and conversations possibly. So, consumers are going to need to lead the demand in toxin-free products, and they're beginning to. We've got Healthier Hospitals Initiative. Google's developed a materials construction program, that rewards manufacturers who provide transparency, so provide information about the materials and chemicals used in their products, and trying to reduce those red list chemicals that are used. And then IKEA has made many commitments to reduce the use of toxic substances in their products. Rating systems. We've got health and building rating systems now, LEED version 4. We've got the Living Building Challenge, Fitwell. Fitwell was developed as a Corps of Engineers standard and then developed into a product that can be used by the public, and now the Well Building Standard, which is a for-profit corporation that's entered the industry and the business of promoting healthy buildings. And then we, as mechanical engineers, as building service engineers, we can look at this as an opportunity to expand our subject matter expertise, and also the types of services that we offer: air quality testing, water quality testing, ventilation testing, and balancing. That's the top of my ugly head looking into a unit. But building retro commissioning, material transparency, in other words, good specifications and policies on what we select to use in our buildings, and then lastly, building certification systems. So what should ASHRAE and CIBSE be doing in this area? Well, I know ASHRAE, we have our Environmental Health Committee, and then last year we formed a Health and Wellness in the Built Environment Multidisciplinary Task Group. So our committees, I've served on numerous technical committees, written a few articles, handbook chapter, chaired a standard committee. So participate in our committees, not just in your day job, but get involved in the conversation. Everybody listening to this presentation is an expert at something that's worth being shared with your colleagues in the industry. You've learned something, and I don't care if you've been in the industry 1 year or 50 years. There's something you know that's worth being shared with your colleagues and friends in the industry. Create position documents around these subject matter areas. You all have, I think last week's webinar was on your new technical memorandum, TM40, which is health and well-being in the built environment. I haven't had a chance to look at that webinar yet, but I think the guideline is about to be published, and I've read through its table of contents, and looks like it's going to have some information that's very useful to the design, construction, and operation engineers and facility managers. That's not really been put together in a format like that's as concise and in one place before. So I'm looking forward to getting a copy of that when it's available. As always, improve our standards, our guidelines, and certainly include our training, and where people need specific training and detailed training, develop training materials and coursework that addresses those needs. Increase our certifications into these areas of subject matter, and then advocate with our public officials that our municipalities, our cities, our school districts, and our governments adopt and promote the use of these consensus-based industry standards as our standard of care in designing, building, and operating buildings of the future. And with that, Tim, I think I've come close to hitting my 35 minutes, and would certainly entertain taking some questions from the audience if you've received any.
Thanks very much, Dennis. That was certainly a flying high-level visit through health and well-being or wellness in
Absolutely.
building. As Dennis says, we would be remiss in not noting that new TM40 provides in-depth discussion on everything, I think, that Dennis has covered today. So that's certainly a great reference. And of course, if you're a CIBSE member, you will be able to download it for free when it's up on the website. So let's get straight into the questions. And there's also some well, quite a few statements, I guess, really, Dennis. And so perhaps something you're about to comment.
Absolutely.
On.
Sure.
Okay, first one from David, and David asks. David says that the particles in the air have been mentioned at low RH, low relative humidity levels, and if the RH is at a more comfortable level, 50% RH maybe, will this show a reduction of the of perhaps the actual number of airborne particles, but also the impact of airborne particles?
Gosh, David, I mean, I don't know the exact answer to that. I just know that in my local environment, we don't tend to recommend ranges beyond 40. We like to see ranges in buildings between 40 and 60%. We see increased mold and fungal growth in buildings that have relative humidities greater than 60 to 70%, and then we see in the lower humidities below 40, in the 20s and 30s, increased respiratory discomfort from, I guess, sinus passages and throats drying out, and just you know, respiratory discomfort. I don't know if there's respiratory disease associated with extremely low RHs or not, but that's what I know about it. I'm happy to research. I've given you my email address there, and if you want to correspond with me, I'm happy to ask some of the people more expert in that area in ASHRAE to give you some more information.
Okay, thanks for that one, Dennis. And of course, one of the experts is one of the past presidents of ASHRAE, Bill Barnfleth.
Absolutely.
Is an expert certainly in ultraviolet. And I've got a question on that from Verid. And Verid asks, you showed some fairly dated data.
Right.
Some data from 2002, I think. He reflects from slide 23. Has there been more work which brings us up to date on that? Do you know? Is there more information on use of ultraviolet?
I don't have a specific study, but I do know that it's timely that a UV manufacturer's representative provided the technical presentation at my local ASHRAE chapter meeting last week, and it was very informative at some of the information they were providing. I don't know how much of it is research based, but and not sales material, but it from a hospital standpoint, UV's been used for a long time, especially in the control of tuberculosis and some of the airborne diseases, because it's very effective at drying out and killing the little modules or nodules of that disease, that organism. And it's also been shown to reduce the growth of algae and fungal material inside air handlers. But I'm not aware of any of the more recent research.
Okay, well, if I Google Bill Barnfleth, and he's at Penn State University, I believe, they have done research on that, and you'll probably be able to find some more on that if you need it. So let's go on to the next one. Interesting question, this one, and very timely. This is from Graham, and Graham's listening in the middle of the night, I guess, on the Gold Coast, on the west side of Australia, at Coolangatta. And he just he mentions that they have a situation of very poor air quality at the moment, due to bushfires, of course. Not dissimilar, perhaps, to the problems in Delhi and other areas of that area of India, where the outside air quality is so poor that can actually disrupt air quality and maybe and likely cause health problems. Are there? You showed some slides earlier intimating that we can use natural ventilation. Have you got any thoughts on how we can tackle the challenges of poor external air quality?
Well, ASHRAE started, and they've started looking at it, and it's been in response to disaster mitigation, looking at the wildfires in California and such, in very similar manner. So I think our ventilation, our environmental health committee are working on position documents and guidelines toward how to deal with kind of a sudden spike in poor outdoor air quality. I don't know, long term, when you're in outdoor air quality so bad all the time, it's just filtration and air cleaning, and keeping your, and if you work inside, of course, that's beneficial. If you work outside, that's tough to keep yourself from being exposed to that poor outdoor air. But the biggest thing is in those areas I've seen so far as recommendations is stay inside, good filtration, and change filters often.
Okay, I think a very practical solution there. But interestingly, I've got a statement really from Karen.
Yeah.
She's from London, doing some research in this area, and she just to give a flavour of what she said. She's saying that the ventilation behaviour of occupants is really very difficult to predict, because we don't understand quite what relationship there is between the need for ventilation and the occupants' actions. And of course, that will be tied up in some way in their perception of the external environment. And of course, in many situations, it's not as simple as advising occupants to open windows, as this could have a deleterious effect on the internal environment. So it is a real challenge. And it'd be interesting, Dennis, to just follow the work of that committee you've mentioned.
No, I totally agree with Karen. I mean, you don't want to open windows and introduce poor air quality if that's the case outside. And if you are opening windows in a building that's air conditioned, just like we all walk down the street and see the retail door spaces with their doors wide open, we want ways to control our air conditioning systems when those windows are open, so that we don't increase energy consumption and things like that. But that will be interesting, and I think again, there's just no lack of opportunity for young people entering this industry to take up the torch and dive deep into these areas of research and learn more than the people that have come before us, and improve on the guidelines and standards they've created.
Okay, well, I've got a question here, and this question perhaps is a solution to it all, Dennis. This is from Ling, and Ling asks quite straightforwardly, if we use a WELL building standard and a LEED system together, does that make a healthy building?
Well, I guess I don't want to be negative about either one of those standards, because they're both very good standards. I think they use the cautionary rule in many cases, especially the well standard. We've actually just completed doing air quality testing in accordance with that standard on our first large office building, about 600,000 square feet. And I will tell you, it's rigorous. It covers a lot of chemicals, a lot of particles, and the tests are not cheap. And those certifications, while LEED has been around long enough now that I think some of it is standard practice and does not add to the cost of a building. Building to both LEED and the well standard or living building challenge, and earning some of those the pedals on that can be expensive, and definitely need to be understood by a consultant or anybody recommending certification, and the owner needs to understand the costs involved in building a building to those standards.
Well, thank you for that very diplomatic answer, Dennis. Let's just move on to a very practical question, and it may be beyond our webinar today, and I know there are many references about this, but we've got a question from Gaston here. He's in the middle of England, and he asks, how can blue light affect the alertness and circadian rhythm?
Well, I mean, if you were to look at the slide where you go from warm to blue light, just the blue light increases serotonin, and just think about before we had artificial light and we could work 24/7. That's our blue light was the cue that it was daytime, and to become more alert and begin moving around and doing whatever things we needed to do to satisfy our needs for subsistence during the day. The blue light allows us, our eyes to see and determine the warmer and dimmer lights of the night and the afternoons and evenings. So the science behind all of that, and how our brains and eyes receive that light and trigger those parts of our brain to become more alert and more cognitively aware. I'm not an expert in, but that's how it does it. It triggers receptors in the brain and increases levels of serotonin to make us more aware and more alert.
Okay, thanks. And if people did want to know more about that, there's not wanting to push my articles. If you look in the CIBSE journal, so that's cibsejournal.com/CPD, there is an article, module 147, which gives you a brief introduction to that, lighting the way for occupant well-being. So if you look at cibsejournal.com/CPD and search for module 147 and 149, in actual fact, 139, you will see some information on that if you want to get some more details, Gaston and others. Got a question, another very practical question here, and I think you've answered this to a certain extent, Dennis. But Charles asks, do you think that humidity control is important in health and well-being in buildings, and is it actually important to mitigate airborne contaminants, which I think you've touched on? But a final part of this question is, what is the range of humidities, which would be the sweet spot, the healthiest range of humidities to try and maintain in a building?
Well, I think ASHRAE 55 would probably give some guidance on that. But the ranges that we designed to here in this warm and humid climate that I'm located in are to stay between 40 and 60%. That seems to be the sweet spot for our locality. One, as far as the energy required to maintain it. When we have wet bulb temperatures in the 80s and dry bulb temperatures in the 90s to 100s here on the coast, it takes a lot of energy to bring moisture out of outside air. But we don't have a problem with having to humidify air in many cases. But I do, as I mentioned earlier, that humidities lower than 40% tend to cause some respiratory discomfort just because of the drying effect on our membranes and our noses and throats and our lungs. But yeah, I think it's very important, and anything that affects comfort will affect our productivity and our ability to focus and concentrate on the task at hand. So it is important. We all, I think it's been shown that fungal growth and molds and funguses grow at accelerated rates and bloom at relative humidities above 70. So I think if you're measuring RH, some of your alerts and notifications to building operators should be starting to raise some alarms, when you start going above 60 and start approaching 70 and percent RH and above.
Okay, thanks. One final question, if you will, Dennis, before we finish for a day. And this comes from Kate, and Kate asks, well, she just made a statement here. I'll just praise it, that we're used to using life cycle assessment when perhaps looking at a energy improvement in a building, perhaps insulation or something, and determining the optimum thickness of insulation. Is there any research you know of that's looking at optimum factors for building life cycle benefit for health and well-being? So really looking at trying to cost the benefits of improvement of things such as indoor air quality.
Yeah, so I think that's part of some of the work of WELL, but I know the Living Building Challenge is focused on that as well. And then the groups producing the red list chemicals, we've got the cradle to cradle certifications, and we've got the Athena group, which one of the older actual tools for doing life cycle assessment of materials from point of extraction to the day you dispose of them. So I hear and I've heard, even at our own building performance analysis conference, this push that life cycle assessment is only interested in carbon, and that's not the case. When life cycle assessment was originally envisioned, it covered the gamut and looked at the effects of materials and looked at the whole life cycle, not just energy, but the effects on productivity, health, wellness, our well-being as well. So there's a lot of people looking at that, and I think you'll see LEED, WELL, Green Globes, Living Building Challenge, and other researchers such as Harvard, and taking a deeper dive into that part of the life cycle cost of everything, not just buildings, but the life cycle cost of living a healthy and productive life.